Your legs feel heavy, weak, or cold. And your doctor says it's aging, but there are specific reasons this happens after 70 that almost nobody tests for. Think about the last time you got up from your chair. Did your legs feel like they were filled with sand? Did you have to wait a moment before you could trust them? That is not just aging. That is a signal. 74-year-old Carol had that feeling every single morning. She mentioned it to her doctor 3 times over 2 years. Each time, she was told, "It's your age." Nobody asked what medication she was taking. Nobody connected her statin or her metformin to her legs. Carol is not unusual. Most women in her situation are sent home without a test that takes 5 minutes, without one question about their prescriptions, and without a name for what is actually happening in their legs. Here is what makes this different from everything else you have seen on this topic. Most circulation advice for seniors is built around supplements: vitamin K2, high-dose fish oil, niacin. If you are on a blood thinner, a statin, or metformin, some of that advice is not just unhelpful, some of it is dangerous. The people who never hear the medication safety layer keep taking supplements that can interfere with their prescriptions. The ones who do hear it ask 2 specific questions at their next appointment, and that changes everything. Before we go further, have you or someone you love been told that heavy or cold legs are just part of aging? Tell me in the comments. I read them, and your experience matters for what I cover next. I'm Dr. Sarah Kim, emergency medicine physician, 15 years in preventive care. Let me show you what I found. In my practice, the patients most likely to have undiagnosed leg circulation problems are the ones already on multiple medications and whose symptoms are being blamed on the drug's list of side effects rather than investigated as something else. Let me show you what is actually causing this and which of your medications may be part of it. Think of your leg arteries like a garden hose. When the hose is soft and flexible, water flows easily. When the hose gets stiff or partially kinked, the water slows down. After 70, 3 things can narrow that hose, and 2 of them come from your medicine cabinet. The first is actual narrowing of the arteries in your legs. This is poor circulation. The medical name is peripheral artery disease. The blood simply cannot get through as easily. The second is your statin. Statins lower cholesterol. They are important drugs for many people, but they can also cause something doctors call statin-related muscle symptoms. The statin makes your muscle fibers inflamed or weakened. The result feels like heavy, aching legs. It can be confused with poor circulation. It is a drug side effect with a fix. The third is metformin. Metformin controls blood sugar, but over years of use, it quietly stops your gut from taking in enough B12. B12 is the signal wire for your nerves. Without enough of it, the nerves in your legs stop sending clear signals. Your feet feel numb or cold. Your legs feel weak. It can look exactly like a circulation problem, but it is actually a nerve problem caused by a drug. Now, here is where supplements make this worse for a specific group of you. If you are on warfarin, a common blood thinner, and you take vitamin K2 in any standard supplement dose, you can reduce the effect of your blood thinner by 40% or more. That is not a minor interaction. That is a safety issue. I will explain exactly what to do instead. Starting with the test, almost nobody orders. On the circulation test, almost nobody orders. A JAMA study of nearly 7,000 patients found that 29% of adults over 70 had peripheral artery disease, narrowing in the leg arteries, and 55% had never been told. Classic cramping pain when walking appeared in only 11% of cases. Most felt heaviness, coldness, or fatigue. A 2025 survey found the ankle brachial index test is used as a first check by fewer than 3 in 10 general practitioners. A result below 0.9 means your leg arteries deserve a closer look. What that means for you. Ask your doctor for an ankle brachial index test by name on statins and leg weakness. A multicenter study published in the Journal of Internal Medicine followed 561 adults aged 70 and older. The study compared two groups of adults over 70, one on high-intensity statins, one on a lower-dose statin combined with a drug called ezetimibe. In the high-intensity group, 5.7% developed significant muscle symptoms: heavy, aching, weak legs. In the combination group, that number dropped to 0.7%. Both groups reached the same cholesterol targets. A 2025 review confirmed that some statins are absorbed through fat, others through water. The water type tends to cause fewer muscle problems. Your doctor can tell you which type you are on. What that means for you. Leg heaviness on a statin is not just aging. There may be an equally effective option with fewer muscle effects. Your doctor can tell you which type you are on metformin and nerve signals in the legs. 2 research reviews, in Diabetes, Obesity and Metabolism in 2022 and Communications Biology in 2023, confirmed long-term metformin use disrupts gut bacteria that absorb B12. The American Diabetes Association recommends regular B12 testing for anyone who has been on metformin long-term. Most patients on metformin for 4 or more years have never had this conversation. What that means for you. A standard blood count does not always catch early B12 deficiency. Ask for a serum B12 test by name on K2 supplements and blood thinners. A study published in the Journal of Thrombosis and Hemostasis tested vitamin K2 at doses as low as 45 micrograms per day, the standard retail dose, in warfarin patients. Even at that low dose, the drug's blood-thinning effect was reduced by approximately 40%. Even at 10 micrograms, a dose lower than most retail supplements, the blood-thinning effect dropped in more than half the people in the study. What that means for you. If you are on warfarin, do not take K2 supplements without direct guidance from your prescriber. Standard retail doses are not safe. On safe food choices for blood thinner patients. A 2024 study confirmed that beets and leafy greens help keep blood vessels healthy, and they do not interfere with warfarin. A 2016 review of 573 warfarin patients found fatty fish 2 to 3 times per week did not affect warfarin levels. High-dose fish oil at 3 grams or more carries documented bleeding risk with warfarin. Food. Safe. High-dose supplement. Not safe. Here is your 4-part protocol. Each item is a specific ask for your next appointment. Ask 1. Say this to your doctor. I have had heavy, weak, or cold legs for some time. Can we do an ankle brachial index test? Use those exact words. If the result is below 0.9, ask for a referral to a vascular specialist. Ask 2. If you are on a statin, say, I have leg heaviness. Can you tell me whether I'm on a fat-soluble statin and whether a water-soluble option or a moderate dose plus ezetimibe combination is appropriate for me? You do not need to know the drug names. Your doctor does. Ask 3. If you have been on metformin for 4 or more years, say, I have not had a serum B12 test specifically. Can we add that to my next blood draw? A standard blood count is not the same thing. Ask for the serum B12 by name. Ask 4. If you are on a blood thinner. Tell your pharmacist or prescriber about any supplement you are considering before you take it. For food, beets, leafy greens, and fatty fish 2 to 3 times per week carry no blood thinner interaction and support healthy blood flow. High-dose fish oil supplements and K2 supplements are not the same as food. Do not take them without your prescriber's direct input. On walking. A 2025 analysis found that supervised walking programs resulted in significantly better outcomes for leg circulation than home-based walking done without structure. If your doctor confirms a leg artery issue, ask specifically about a structured walking referral, not just walk more. After meals, a 10-minute walk was shown in a diabetes care study to reduce post-meal blood sugar by 39%, particularly relevant if you are on metformin. Before I close, let me tell you what happened to Carol. Carol got those answers. 6 weeks after her doctor switched her statin type and confirmed her B12 level, which had dropped after 7 years on metformin, the heaviness in her legs was noticeably reduced by morning. She told me it was not dramatic. It was not a transformation. It was waking up and not immediately reaching for the wall. The coldness in her feet did not fully go away. Her ankle brachial index came back at 0.88, just below the threshold for concern. She now has a vascular referral and a structured walking plan. She knows what was happening. She knows what to watch for. She knows what to ask next. That is an honest result, not a cure, a direction. What I want to be clear about is this. Many of the medication causes behind heavy, cold legs can be reversed, but only when they are found early. When K2 supplements are adjusted or stopped, when statin-related muscle problems are addressed with your doctor, circulation often improves within weeks to months. The damage that accumulates silently, the kind Carol was living with, does not have to be permanent. Your body's capacity to restore blood flow, particularly before significant vascular damage has set in, is considerably greater than most people are told. Here's what I want to know from you. Have you been told that your leg symptoms are just aging, while you were also on a statin, a blood thinner, or metformin? Have you ever been offered an ankle brachial index test? Tell me in the comments. I read every one. Your story may be exactly what someone else needs to hear before their next appointment. This is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. You are someone who now knows the questions to ask. That is not overcaution. That is how people in your situation get better answers. If you have a spouse, parent, or friend managing leg symptoms after 70 who is on a blood thinner, a statin, or metformin, share this with them before their next appointment. The people who most need to see it are often the ones least likely to search for it. I get messages every week from people who feel heaviness and coldness in their legs and have been told it is just their age, and who have never once been asked about their prescriptions. If that is you, subscribing means you will see the next video in this series, which covers what happens after an ankle brachial index test comes back abnormal and what your options actually are. Next week, what to do when your leg artery test shows a problem and why your options are more specific than exercise and statins. Right now, think about standing up from your chair in the morning without that moment of waiting. That is what this is for. I'm Dr. Sarah Kim. I'll see you in the next one.